This is Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And I'm reading part of the X-ray report on the thoracic spine. There are multiple vertebral end plate irregularities associated with wedging of several of the lower thoracic vertebral bodies. Some Smorls nodes are present and there's minimal scoliosis. The combined appearances are consistent with Scheuermann's syndrome. There is secondary spondylitic changes with reactive marginal osteophytosis, which is bridging anteriorly and right laterally from T6 to T10, causing partial ankylosing of the spine. So at a 6th thoracic through 10th thoracic vertebrae, those are essentially fused. And I wanted to demonstrate the value of spring testing, and given the unknown of how much mobility he may or may not have. And so I'm going to come here, this is upper lumbar, and so we're approaching the thoracic spine, and I can load this and I can spring it, and I can see his head bobbing up and down a little bit. And I continue that process, and I can see his body moving. I don't know if the camera view is adequate for capturing that, but I can take up the slack in the system and then perform a forward thrust and induce more motion. Come here, big difference. I'm simply just not able to even take up the slack, and I'm doubling the amount of force, and there's no give there. So that's probably T10 there. I'm getting nothing at this next segment up, nothing here, and I'm putting an excessive amount of force. Same thing here, and same thing there, and then right here we start to get movement again. So I can take up the slack at this segment, and then I can spring it. And I see his head bobbing up and down, and I think you can see some soft tissue contours. So yes, between here and here, he's got this block of wood that's not yielding. What is nice is that he has mobility of the corresponding ribs. And so it's an interesting diagnosis, and the radiologist chose the word Scheuermann's syndrome. And most people with Scheuermann's kyphosis and or ankylosing spondylitis, they lose excursion of the ribs. So this is certainly a variant, and so I would say that Scheuermann's syndrome is a good terminology to describe that. But the rib mobility is good, and that's fabulous. So I hope that was meaningful, and I was trying to show that with the spring testing you can find parts of the spine that are mobile, and you can identify sections that are not mobile, and hope that's informative. Thank you.